Welcome to Nasdaq Trade Talks. I'm your host, Jill Malandrino, global markets reporter at Nasdaq. Joining me at the market site in Times Square, we have Andrew Hoppin. He's the founder of CoverUS, and on behalf of Next, powered by Schulman Rogers and Nasdaq, welcome to the market site studio. What is CoverUS, and what inspired the creation of the company?
So CoverUS is a mobile app that helps engage patients to help them be more financially well so that they can afford to be healthier. And we were inspired to create this because I was learning about how unequal our health system is, how just because you may not have $50 or $100, you don't go get a checkup, then you get sick, and it's bad for everybody in the health system. So even though we spend more money per capita than any other wealthy country in the world on healthcare, we actually have worse health outcomes than most of our wealthy peers. And one reason for that is that people don't have enough money to do what they should do in terms of engaging in care. So I may not fill my prescription, I may not go get a checkup when I should, just because of a little bit of money, even though our system spends so much money. We're trying to move money around so that you have enough to actually do what you should to be as healthy as you can be.
So what does the model look like?
So a patient can download our mobile app, connect their electronic health record, and make a simple choice to allow that data to be used to find opportunities for you to earn money, doing things like engaging in market research, filling out surveys, doing things like finding the best place to get your prescription or your medical procedure or an over-the-counter product at the best price. The result of that is you end up with more money in your pocket so you can be afforded to be more well.
Preventative healthcare will keep healthcare costs down the road. Why doesn't something like this already exist then? And do you think it can succeed this time?
Yeah, we certainly hope it can succeed this time. We'll see. We aim to prove that. The reason this hasn't existed yet, even though it makes all the sense in the world, is that until very recently, it was very hard for individuals to get access to their electronic health record, let alone to permission a mobile app company like us to actually use the data in that record to be of service to you. At the same time, the industry now actually wants to talk to you. They want to know what's happening to you when you're not in the doctor's office, because we're moving to something called value-based care. Finally, in this country, we're paying for outcomes, you actually being well, not just for medical procedures or interactions. And that means that when you go home from the doctor's office, what happens there and the data that you created there is just as important as what happens when you go to the doctor.
All right, well, let's talk about that data. Do you think we should actually own our own personal data, and why should we trust you with it?
Yeah, so great question. So we think certainly morally you should own your own data, but it's a lot more complicated than you might think. For example, my genome actually says a lot about my sister's genomes. If I own it and I can sell it maybe to make some money, I'm actually potentially exposing her to a privacy risk. So it's not quite as simple and cut and dry as you might think. That said, our data should absolutely be something that we have a right to make choices about. What is done with it, what is not done with it, and most of all, it should be put to work for you. And why should you trust us? We're just some social entrepreneurs off the street. 3 reasons. Number one, our business model. So we only make money when you make money, and we always make sure that you, our member, make more money than we do. Number 2, we're building a blockchain technology that allows us to prove to anybody in the world that we're actually doing what we say we are. You don't have to take our word for it. And number 3, we're in a regulatory time when I think in a very good way, privacy laws are moving to a point where it's going to be very hard for companies to surveil you without your knowledge. You're actually going to have to directly come to you and ask you, what are you okay with and what are you not okay with your data? And we're subject to those laws just like anyone else.
All right, now your background, government CIO, successful civic technology entrepreneur. How has that prepared you for this new venture with CoverUS?
Yeah, so 2 ways. I worked for many years with government data, both as a government CIO and then as a GovTech entrepreneur. Very comfortable with finding data sets that are fragmented, that are messy, turning them into useful data insights that can be put to good use. And we're just doing that again here. Even in a very heavily regulated environment, our team is very comfortable doing that, number one. Number 2, we spend our whole life using technology to help people. And so this is another version of it. We're building a for-profit social venture, but our team has the bona fides to be trusted and to do this well.
What do you hope to see from the healthcare system in the future?
So if we're going to spend so much money on healthcare, I want us to have the best healthcare outcomes in the world. I want Americans to be the healthiest people in the world because of all the investment that we make with our tax dollars and with our consumer dollars. And if we just do a better job of balancing the tension between keeping data private and sharing it where it can create value, and we give people the economic means to do what they probably want to do anyway, we think we can actually have the best healthcare outcome in the world. Even if we're spending the most money, that's not where we are today, and that's just wrong.
All right, to wrap up here, how big can CoverUS get?
So this is a big issue in the United States in particular, and we are about 1/3 of the world's healthcare spend, so it's great that we're starting here. But when you think about it, this is relevant in every country in the world. Even in single-payer markets, say if you're in Canada and you have Crohn's disease, you're spending hundreds of dollars out of pocket every month just so you can stay well enough to go to work. So money, health data, and engagement of patients matters worldwide. It's one of the biggest industries in the world, and if we're successful here in the US, we hope to take it worldwide.
All right, Andrew, thanks so much for joining us at MarketSite. And thank you for joining me on Trade Talks. I'm Jill Malandrino, Global Markets Reporter at Nasdaq.